Hi, everybody. My name is Dr. Jessica Ailani. I'm from the MedStar Georgetown Headache Center in Washington, D.C. Thank you so much for joining me today on this Facebook Live program, and we're going to talk about acute migraine treatments. I'm happy to be here to share some updates on some new treatment options that have been FDA approved in the last few months, and they might be some options that you can consider talking to your provider about after our Facebook program today. So I'm going to be talking just for a couple of minutes and give you a nice little overview of these two new categories of treatment options, and then we're going to open it up for some questions. I might not be able to get to all your questions today, and in particular, I want to focus in on questions that I might be able to answer for you. But really, my job is to describe these products to you and give you enough information that you feel comfortable going back to your care provider, whether that's your primary care doctor or nurse practitioner, or if it's your neurologist or your headache specialist. And then you can ask them a little bit more if these might be the right options for you. So acute migraine treatment is something every person with migraine needs to have. And I like to think of it as anything that's in your toolbox that makes you feel better when you're having a migraine attack. So that might be a prescription medication. It can be something over the counter. It could be an ice pack or an ice cap. It can be a neuromodulation device that you use at the start of a migraine. These are devices that have been cleared by the FDA for safety and have evidence to show that they can be very helpful during a migraine attack. These can be scents or smells that make you feel better, like lavender, or balms that you put on your head during a migraine attack, glasses you wear to reduce the glare from overhead that really aggravates you during a migraine, or earplugs you put in just to reduce all the noise that's coming on around you. It can be a variety of things. Today, we're going to focus in on two new categories of medications that have been FDA approved for acute treatment of migraine in adults. And these are medications in a category known as ditans and gepants. So funny words, but they're large category names, and they're different than what we have today. For example, we might be using triptans or NSAIDs or ergotamines, and now we have two more little funny names to add to our group of medications. So the first new treatment class we're going to talk about are ditans. And ditans might work by making the nerve that causes head pain, the trigeminal nerve, become less active so it doesn't send so many angry signals into the brain and tell the brain to, hey, not have migraine pain when it's happening. Right now, we only have one ditan on the market called lasmiditan. Lasmiditan has three dose options: 50 milligrams, 100 milligrams, and 200 milligrams. These are pills that you take with water at the onset of a migraine. Studies have shown that one dose of lasmiditan can bring symptoms of migraine, both migraine pain and most bothersome symptoms. So that's things like light sound sensitivity or nausea during migraine. It can improve these symptoms for most patients within 2 hours, and a portion of patients can be completely symptom-free within the first 2 hours. Side effects can include things like feeling dizzy or tired, having tingling or numbness in your hands or your feet or around your mouth. This is what we call central nervous side effects, or what I call brain side effects. You know, my brain is really activated, so it feels funny, and I feel a little bit funny after. Because of the way it works, and because it can cause some of these brain symptoms, the FDA asked that a couple of further studies be done to check how people do when they drive on this medication, or if they would have any kind of problems, like if somebody who has a history of drug abuse would be more likely to like this medication. It's what we call a study that takes a look at substance abuse issues. So this has been looked at in people who have a history of substance abuse problems, and they were given a dose of lasmiditan, and then they were given a dose of something like alprazolam. And they wanted to see if they would prefer lasmiditan to alprazolam, which they did not, and if they would prefer lasmiditan to taking nothing, which they did. So this has earned lasmiditan a controlled substance labeling, very similar to other medications that we use in the headache sphere, like pregabalin, for an example, and it might differ from state to state. The driving study was done, again, to see how patients drove after taking a dose of the medication. So they took people who were healthy subjects, they gave them a dose of lasmiditan, and they had them go through a stimulation study that stimulated driving. And they found that within 90 minutes of taking the medication, people in the study didn't drive so well, more likely to get into an accident, even if they felt fine. So they might not have felt dizzy or tired, but still had trouble driving. So the recommendation is that after taking a dose of lasmiditan, you do not drive for 8 hours. So these are the two big things to realize with the medication. Other important parts with lasmiditan that you need to know is that it does have an ability of causing serotonin syndrome. At least it's on a warning, just like triptans have that warning. So you need to talk to your provider if you're taking any other medications that work on the serotonin system. So that's an antidepressant, or if you're taking a triptan, to just be cautious about not using this together. Lasmiditan does have the potential for causing medication overuse headaches, so its use should be limited, probably to less than 10 days a month. And safety has only been studied at 4 doses a month, so it's an important thing to remember. Let's talk about the other class of medications, something called gepants. I still remember the day I had a patient come in and she told me that she wondered if it was a type of new yoga pants, and I tell you that I would love to get a pair of pants with gepants on the side. I think that would be pretty fashionable. But no, it's actually the name of a new category of medications. gepants work on the CGRP system, and many of you might realize that sounds really familiar because this is a system that we have been working on for the last few years, and we have preventive medications that you can inject once a month that you might be using already that work on the CGRP system. So gepants, I would describe it as, how do they work? If they work on the CGRP system and you imagine that, these chemicals have to go and park somewhere, gepants are like a big car sitting in the middle of your garage. They take up so much space that nobody can park around them, or that really obnoxious person that parks in 3 different parking spots sideways because they don't want anyone else to take over their area. That's like a gepant. It's parking in the middle, so the CGRP can't come and park where it needs to go, and then it can't do what it needs to do. We know that CGRP plays a big role in migraine. It's part of what starts a migraine attack, and it's part of what keeps a migraine going. So if we block CGRP's ability from parking, it can't go on and cause all those symptoms in migraine. So the earlier we do that, the better a patient potentially has to do. So we have these 2 gepants on the market. One of them is called ubrogepant, or Ubrelvy is the brand name, and the second is called rimegepant ODT, or Nurtec ODT. They both show pain relief and relief from most bothersome symptom, again, things like nausea, light sound sensitivity, within 2 hours. And then some portion of patients can be completely pain-free and symptom-free within 2 hours of use. Side effects for ubrogepant are nausea, somnolence, and dry mouth, all for about 4% of people or less. And side effects for rimegepant ODT are nausea for about 2% of people or less. What's the difference between the two? I get this all the time in clinic. Very easy question with a really not a very easy answer. They both have pretty similar effects. When we look at the clinical trials, they both work pretty well. But there's a little bit difference in how you use the medication. Ubrogepant comes in 2 dose options, 50 milligrams or 100 milligrams. It's a tablet you swallow with water. So I think that is one of the bigger differences. You can also take a second dose if needed in 2 to 24 hours. So say you take a dose and you're not feeling better within the next few hours, or you take a dose and that pesky migraine, it comes right back several hours later, you can take a second dose in the same day. Rimegepant, however, is an oral dissolvable tablet that you put right under your tongue. So this is great if you're nauseous, or if you don't really want to drink water, or if you're in the middle of work and you don't have water next to you, just slip it under the tongue and within 15 seconds it dissolves. Because it's an oral dissolvable tablet that works in a good way, it doesn't just sit there and not really melt. The studies actually show that it has the ability to work a little bit faster than the pill if you have a pill dose of it and you swallow it with water itself. So I do think you get a little bit of an edge in faster efficacy. The other thing about rimegepant is you only take 1 dose. You don't have to take a repeat dose, so it's 1 in a given day. And for some people, that's really nice. They want to just take their 1 dose and not think about it again. Well, I have other patients that tend to have migraines that maybe last a longer time, and they feel very uncertain about, if I only have the option of taking 1 dose, what if I need something to rescue? Important thing about gepants, you can take rescue options with a triptan, with an NSAID, with an antiemetic. We go back to the ditans. If you need a rescue, you can take an NSAID or an antiemetic, but you don't want to take a triptan within the same day, and you don't want to take an ergotamine. So this is a big difference between those 2 categories. Another difference between rimegepant and ubrogepant is that ubrogepant comes in a pack of 10 tablets. Rimegepant comes in a pack of 8 dissolvable tablets, so that's different as well. So as I mentioned, if you do take a ditan, you decide that this is a better option for you. You don't want to take a triptan after if it doesn't work. You can take an NSAID, acetaminophen, antiemetics like metoclopramide, which we often use because it also is very helpful for migraine. If you take a gepant and it doesn't work, you can take most of your usual medications, as long as it's not a medication that has a barbiturate in it, because that might interact with the gepants. I should mention that gepants don't cause serotonin syndrome. They don't are considered to cause serotonin syndrome. We also do not think they cause medication overuse headache. So I think that's really important for our patients to know. But the gepants can interact with some common medications like antifungal medications or certain blood pressure medicines. So it's really important if you're going to get a prescription of one of these medications that you talk to the pharmacist. You take that moment, you say, hey, I'm not signing this form. I'd like to speak to the pharmacist, and just let them interaction check all your medications to make sure it's not going to cause a problem with something that you're already taking. So this is an extremely exciting time for migraine. I mean, there are things on the daily that are occurring, new things coming out. And just in the last several months, even though we're currently housebound for many of us, all these new options have come out. And I think there couldn't have been a better time for us to have more things to use in case our current standard therapies aren't working for us.